let's move on. We have the last kind of few modules. Module 6 is what a healthcare worker should know. So this is a little bit of review, but I think it's really important to sort of for you all, but also educating community healthcare workers on symptoms of gastric cancer. So what types of symptoms might they be reporting? That include dysphagia, fatigue, unintentional weight loss, abdominal pain, nausea and vomiting. And then signs of gastric cancer, particularly on blood work, might include anemia or vomiting of blood, vomiting something called coffee grounds. So when blood is digested in the stomach, it can look just like coffee grounds. So it looks sort of dark and particulate. And then melena or black stools. Also important to spread the word that gastric cancer can be caused by a bacteria called H. pylori, which is very common in much of Africa, but very treatable. And then when patients are diagnosed early, gastric cancer is curable, but if diagnosed late, which is unfortunately more common, treatment is palliative. Also sort of messaging how to take care of patients after they've had treatment. So for patients who've had a gastrectomy, they may get full easily, therefore more frequent and smaller meals are probably easier to tolerate. We recommend monitoring for B12 deficiency and iron deficiency in these patients. And then if patients after a gastrectomy were to have trouble swallowing, dysphagia can sometimes result from strictures due to scar tissue, so that's important to just keep in mind. For patients receiving chemotherapy and radiation, recall that chemotherapy may cause fatigue, nausea, and increased risk of infections, and we really encourage hydration and more frequent and smaller meals for patients who are receiving chemotherapy or radiation.